health system, that we need to change the way we work. We have to continue to be very, very clear on the prevention side. And so far we have talked about the individual things that you can do on prevention. We can talk about what governments need to do as well, but we need to really utilize the best buys, the way we can change and reduce the risk factors that leads to NCD. But we also need to learn from the COVID that we have to strengthen the health system in a different way, so also the people living with NCD can get their services as part of essential health services and universal health coverage. So this is very important. So I would say that we are at a very critical juncture. If we are not scaling up our efforts to curb NCD, we will not reach the target that we actually have decided to reach during the Sustainable Development Goals in 2030.
Yeah, thank you for that. This actually goes hand in hand with a question on LinkedIn from Chandra, who's asking, what is the plan of WHO for NCDs after the COVID-19 pandemic? Can you give us some insights there?
Yes, so, we are now working with countries at all levels. So we meet every week, actually, within WHO, where we meet with people from all the regions of WHO, telling us how each of the countries are developing. So the first thing we need to do is to include NCD into the preparedness and response plans. During a pandemic like this, every country has developed a national response and a strategic plan. And we have seen too little reflection on the non-communicable and chronic diseases so far. So the first thing countries need to do is really to look into their response plans to see that also chronic diseases is sort of in the plan when they have a response to a pandemic like that. So that's sort of urgent. So I think we need to understand more that, chronic diseases is very, very important also to focus on during a humanitarian crisis and during a pandemic. And this is not the first time we see that. We see that many times. We have seen it in refugee camps where more people have got their legs amputated because of lack of insulin than of landmines, for example. So that is very, very important. So that's sort of an acute measure. But of course, we need to learn from the pandemic, as I said. So, and there is also very nice learning points. We can see that more and more countries is mitigating the situation by using telemedicine, digital health. They are sort of what we call task shifting. So it's not only the doctors that are sort of taking care of medical things. We also have a shift towards nurses, towards other community workers. We have more focus on self-care, and we have other ways to ensure that people get their medication and so on. So this is really learning points from the pandemic that we will take into the sort of building back better. But then it's, of course, to build back better. And in the NCD area, we have the goals, we have targets. We have targets for tobacco, for alcohol, for how health systems can be strengthened, and so on. And we have goals, as I already mentioned. We know what we want to achieve. So it is the how, and we have to really focus on how are we going to scale up? How are we going to achieve these things? And I think that is something that is maybe needs some more considerations, and it needs more funding as well. So we have tried to summarize this, and one of the learning points is that we need to bring the people living with NCD also to the decision table. We saw this in the HIV/AIDS era, that people living with the diseases actually have a huge set of knowledge on how to implement, because we are talking about implementation. We know very much about what we can do, but we need sort of really to implement at scale. Then, of course, to be more clear on what is essential health services for NCD, and include NCD into what we call universal health coverage. That's also very, very important. And also to strengthen the primary healthcare level, the level which is the first level in the healthcare system that the patient usually seek advice and treatment from. That is also very much important. And of course, we have, I call it the best buy. It's a lot of jargon, but when WHO it works in close cooperation with countries. And we have since 2013 developed a menu of policy options, which we call the best buy. And we know that if countries really implement these best buy, we will reach the goal. So we know that, for example, today 5 million people live in countries where they have introduced smoking bans and graphic warnings and so on, which we know will help them to quit tobacco. And we also know that 3 million people are protected from harmful trans fat, as we discuss, healthy food. And we know that 3 million people now are covered by protocols to get treatment for their hypertension. So these are examples on how we can do that. So that is also very important. Then another thing that is important is, of course, money, because the health budget has to be strengthened. It is not that the cost of prevention of NCD is actually a cost, it is an investment and the return is super high. But if we are so unfortunate that people really get heart, lung cancer and diabetes diseases, we know that the cost for the healthcare system is very, very high. So the cost of not preventing is super high. So one of the things that is really among the best buys and also help people to quit tobacco, to reduce their alcohol consumption and eat healthy food is that we need to use what we call fiscal measures, namely to put taxes on these very unhealthy products. When we put taxes on, we will sort of help and support the population to not choose these products. And at the same time, we will get more money into the health system or into the budget and to the health budget for the countries. So these are very, very important measures.
Yeah, thank you. I know you mentioned this at the beginning, but what exactly is the impact of COVID-19 on NCDs? Because we've had a couple of questions now on social media of people who would like to know exactly what the impact is. Could you just summarize it quickly in a nutshell?
Yeah, so I can summarize in a nutshell and I can also give a couple of examples, but let me summarize first. It's basically two things. First of all, we know that people who has heart diseases, cancer, lung diseases, or diabetes, they are at a huge risk to get more severely ill and die from COVID. So if they get COVID, they are more at risk to get severely ill and also to die. So an example of this is, for example, when we looked into the people dying in hospitals in Italy, we had as many as 67% of them living with hypertension and 31% were living with type 2 diabetes, just as an example. So that's the first thing. So they are more at risk. And the second, which is not as easy to spot immediately, but that is that when we tackle a pandemic, many of the health systems has to be shifted towards, for example, in this case, COVID-19. So the consequence of this is that there is less access for the people who has chronic diseases like the non-communicable diseases. So we have seen in a survey we did back in May, which 163 countries responded to, that 60% approximately of the services for hypertension treatment were disrupted either partially or totally. So one of the publications that WHO came out with last week showed the same, that one of the most disrupted services was for NCD and for mental health. And these are really the people who need these services because they need them almost every week, maybe every day, every month, and so on. And among them, of course, the cancer treatment was also disrupted in 55% of the cases. So more severely ill and risk of dying, and also that the health system is less accessible. I would like to add, because this is very, very serious, of course, but immediately when we realized this, and we realized this very quickly because the healthcare workers alerted their governments, that alerted WHO, and also the civil society was very early on telling, the world that this is happening, we need to do something. So we have, as WHO, developed guidance for governments and policymakers to help them to know how can they sort of reduce the effect as much as possible. But the big learning point is that we need to build back better in a different way to support people living with NCD for the future.
Mm-hmm. Thank you. For everybody who's just joined us now, we're talking about NCDs, also known as non-communicable diseases. So that can be diabetes, high blood pressure, asthma, heart disease, cancers, and so on, and COVID-19. If you have any questions for our expert, please comment in the comment section, or if you're on Twitter, you can use the hashtag AskWHO. Bente, you mentioned previously that individuals can do things to prevent NCDs, mostly through smart lifestyle changes, eating healthy, avoiding alcohol, don't smoke, and that governments can also do things to prevent the spread of NCDs, for example, through policy. But what can the private sector do to prevent NCDs?
So I think there is no difference. We have agreed with, I guess, all stakeholders. I think that everybody understands, So of course, what we want private sector to do is to support the same agenda. So, for example, when it comes to access to medicine, what we want to see is that we have different sort of pricing structures, so people in the developing countries can have more access to insulin, for example, or to other very important drugs. And I can see a tendency that we are sort of getting a little bit closer to this. And we also have seen during COVID that we have had companies donating insulin, for example, for a period of time. So, but there is a lot to do still, and the sort of out-of-pocket payments, sort of the patient's own payment for medicines is too high, and the accessibility is definitely too low for many of the diseases, and many things are not accessible all over the world, and so on. And of course, when you look at the food and beverage sector, one of the first thing, and actually this week, which is an NCD week for all of us, we will see that we will have good news when it comes to trans fats. So we see now that there is a more and more understanding that we need to ban trans fat in food. And of course, then the private sector has to apply and produce food without trans fat. And we can see that coming on. What is very important is that we have seen, unfortunately, undue influence from tobacco industry and from alcohol industry during COVID. And of course, we can imagine people are in a very different setting. They are really much more online, I guess, they are out of their natural routines and so on. And in a sense, they are much more at mental risk for sort of also adapting negative ways of living. So we have seen examples of this, and countries are more and more vigilant to protect their population against this, what we call undue influence, meaning that if we see tendencies that, suddenly there is more sort of positive mentioning about smoking or drinking in films or in advertisements or something like that, this is something we really have to be very, very careful, because we have to protect people against these kind of things. And then I want to mention something we didn't mention earlier in this Facebook Live, and that is also, I didn't speak about the fifth risk factor, because we have spoken very, very much about tobacco. We need to quit tobacco. We need to reduce or avoid alcohol. We need to have healthy food, and we need to be physically active. But the fifth risk factor is also very important, and that is air pollution, both outdoor and indoor air pollution. And we have actually seen how much that means to populations, because during COVID, during lockdown, of course, the traffic has also been stalled in many cities, and we have been able to measure the much lower air pollution level in some parts of the world. So, of course, that is also important, and also that is also coming back to private industry, of course, and private sector, because we also need to shift to less air polluting ways of both, driving cars and all that, but also the way we heat our houses and all of these things as well.
Okay, so a lot of people and organizations have to take responsibility for NCDs. And you just mentioned the risk factors. We have a question on LinkedIn from Nasser, who's asking, if you take the right lifestyle changes, are NCDs reversible?
So I think we cannot say totally reversible, but we can reduce, the people dying too young, meaning before 70 years of age. And we know that reducing risk factors can help us to achieve our goals with 50%, and then we need to also, improve our health system. So, but it's very, very important. We are sure that if we really implemented all the measures, both individual measures, but also the measures done by the government, we will be able to reach the target that we have set. So it's very important. But totally, we cannot get rid of all these 4 diseases, but we can manage them. We can reduce the amount of people suffering from them, and we can also, improve the well-being and life of these people, and they can live longer.
Yeah. Previously, you mentioned the NCD Action Week, which is going to take place from the 7th until the 13th of September. Would you like to tell us a bit more about the NCD Action Week?
So the NCD Action Week, we are very happy about this. It's organized by our very, very acknowledged partner, NCD Alliance. And it is something that we from WHO support very much. And it gives us an opportunity both to sort of highlight, the challenges, but also the solutions. So I am very happy that we are able every day now to give an example from countries, how they have started to work in a different way. We can learn from that, and it really give us a hope for the future. And we will also have, during the week, launches and events, both on how we can strengthen healthcare systems at primary healthcare level, and how WHO can support that with something we call PEM packages, which is really the way that healthcare workers and health systems, even at the most sort of least resourceful levels, can support the patients, and we can really give good management. And also we will have launches on healthy food and trans fat. So it would be very good to both have the response from the listeners here, and also, of course, there is a golden opportunity for all of you as well to use the event and post both your own experiences, your questions, your solutions online as well.
Okay. We have a question from Nirmal Darnal on Facebook, who's asking if WHO has any guidelines for countries which are mostly affected by NCDs and COVID-19.
So WHO has produced, I would say, a huge amount of very, very important both guidelines and guidance. And I will suggest to anybody online here, and I'm sure Walter can help us as well, to give a link to the webpage. It's actually a very easy, accessible webpage. And I think most questions you may have will be able to find an answer for. And even if there are no answers, you will also be able to see what is sort of in the making, in the doing, in production, so we can be supporting. But there are a lot of guidance. So it's guidance to policymakers. For example, as we discussed now, the change in access to people living with chronic diseases. There is a very important guidance supporting countries on what can you do to sort of reduce the harm and at the same time try to defeat COVID-19. So that is very important, and it's also guidance. When fortunately many countries are now out of the first or out of the worst part of the pandemic, how can they restore and reinstall the health services, in what sort of way should they do that to really accommodate for the people also with chronic diseases. So it's these kind of guidance, but it's also very, very specific guidance. Stay healthy at home, what can you do, tips and sort of, I would say, examples. We have a very, I would say, beautiful suite of guidance on mental health conditions, on how to stay mental health healthy during COVID. It is a beautiful publication for children. Sometimes we forget about the children, but the children is, the hope for the future, and also very, very important to take care of them, good care of them during COVID, and both on the mental health side, but also, of course, on the risk factor side. So it's a beautiful book on mental health. I think it was translated to more than 100 languages. Yeah. So you will find all these kind of things. And I think it's very important, because one of the problems during a pandemic like this is that it's such a sort of diversity of information out there, and especially on social media. And if I could give one advice, if you have any doubt, if you read something that you cannot understand, is this true or not, please go and seek advice on WHO websites, and also your, of course, government, your Ministry of Health, the government will very often have the best guidance for you, both as an individual, as a family, but also in the community or in the government.
Yeah. So you heard that there's a lot of information over on the WHO website. We'll try to share the links in the comment section. Maybe as a summary recap, we have one question on LinkedIn from Zenab, who's asking, what is the link between NCDs or non-communicable diseases and COVID-19?
So we have discussed this a little bit during the half hour, but I think it's absolutely worthwhile to repeat it. So it is basically two things. First of all, people living with living with the non-communicable diseases, meaning heart diseases, lung diseases, cancer, and diabetes. They are more at risk of becoming severely ill and also to die from COVID. So we have many publications coming from national level showing this unfortunate situation. This is number one. And the second is that also chronic patients, and especially people living with non-communicable diseases, has less access to the healthcare system and essential health services during COVID. And this is important information, and it is a call to action. And I said in the beginning that COVID has been as an X-ray, so it has sort of amplified and showed us the situation that was partly there before COVID as well. And this means that we need to build back better so we in the future can have a healthcare system that is better sort of shaped to take care of the people with non-communicable diseases for the future.
Dr. Bente Mikkelsen, thank you so much for taking the time today to talk to us. That was our Facebook Live on NCDs and COVID-19. And I would like to say thank you very much for everybody who has been watching us from around the world, including Angola, the Solomon Islands, Mexico, England, Kenya, Vietnam, Nepal, Bangladesh, Malaysia, Indonesia, Germany, Poland, Greece, Canada, USA, Spain, and many more. Thank you for watching and see you next time.
Thank you, Walter. Thank you. Thank you.